Contemporary issues in advancing clinical practice, the mental health of nurses within healthcare. The National Health Service has faced increasing pressures over the years associated with inadequate staffing, an ageing population, growing pressures on general practices, a lack of funding, escalating costs, and more recently managed the COVID-19 pandemic, to name but a few. Hoax and Walker 2020. Whilst all of these factors are impacting on the NHS, the British Medical Association, the BMA 2023, has stated that increasing workload and chronic understaffing are becoming unsustainable, and there has been a decline in the well-being of staff, which is seeing staffing levels in the NHS at crisis point. According to a recent article published by the Nursing Times, there has been a 37% increase in the number of staff absences from February to June in 2021, which was caused by mental health issues for 2021. This number equates to 885,000 days lost due to absences related to mental health, the NHS Employers 2021. With almost 40% fewer nurses in comparison to 10 years ago working within the NHS, nurses are facing unprecedented demands which links directly to burnout and stress, the Royal College of Nursing, the RCN 2022. This assignment will focus and critically analyse the mental health of staff within healthcare, specifically focusing on nurses and reflecting on the impact that the COVID-19 pandemic had onto nurses' mental health. Employers incur between £33 and £42 billion annually due to presenteeism, sick leave and employee turnover. Despite the fact that this figure encompasses all UK workforces, it emphasises the significance of employees' mental health management. The Department of Health and Social Care 2017. Mental health, according to the World Health Organization WHO 2022, has been defined as a state of mental well-being that allows individuals to deal with life stresses, realise their abilities and perform well at work. The Office of National Statistics, the ONS 2017, identified that female nurses have a higher risk of suicide by 23% above the national average. While the ONS is a credible source of information, there is limitations within these findings, as there is no information on the actual cause of death and if it was a direct link to workplace pressures. With over 700,000 registered nurses in the NHS, the largest nursing workforce within the UK, and female nurses accounting for 88.6% of the nursing workforce, a shift in the way mental health is managed is essential. The NHS England 2021 and the Nurse and Midwifery Council, the NMC 2022. It has been estimated that the COVID-19 pandemic caused a third of healthcare workers to experience moderate to severe levels of depression and anxiety, Galina et al. 2021. In December 2022, mental health issues accounted for over 547,000 full-time equivalent days lost and 20.8% of all sickness absences, the NHS Digital 2023. There are several systematic reviews and meta-analysis that have already demonstrated that nurses worldwide exhibited pre-pandemic moderate to high levels of burnout syndromes, Lopez et al. 2019 and Wu et al. 2020. A more relatable study, which is based in the UK by Kinman et al. 2020, compiled 100 studies in the 10 years prior to this systematic review being published, which found that 30 to 40% of nurses experience burnout syndromes, and a similar nurses experience stress at work. Additionally, the review's finding of high prevalence of mental health issues among female nurses included post-traumatic stress disorder, anxiety and depression, which all give rise to suicide. This relates directly to me on a personal and professional level, as I am questioning myself. Is there enough staff to manage with increasing demands? Are we safe as practitioners? Are we able to provide the care that is expected of us? And can we provide the care that the patient deserves? Will I be supported through governments and organisational levels with the increasing pressures and restraints? Throughout this discussion, I'll identify some of the challenges of which we as healthcare workers are facing. The International Council of Nurses 2021 has warned of a stark threat to the profession, stating that the COVID-19 pandemic could trigger exodus from the nursing profession. They highlighted the potential short and long-term effects that the COVID-19 pandemic can have on both the nurse and the organisation of which they're working within. With healthcare workers facing more complex challenges, change must be made and governments must act to save the already crumbling and fragile system that is the NHS. The RCN 2023 published a report recognising that a huge number of staff are leaving the nursing profession. Inadequate pay, insufficient staffing, workplace discrimination, a lack of career progression and unsafe working conditions are all common themes as to why people are leaving. It is noted that people leave for personal complex reasons too. However, these elements are overburdening the individual, which is impacting on both their physical and emotional wellness. In England, the government pledged that they would recruit 50,000 more registered nurses in England by 2024. There was some evidence to support that they were on track with this promise, as there was 10,500 more staff working within the NHS in comparison to October 2019, the NHS Digital 2023, However, the NMC 2022 issued a most recent Leavers report, which highlighted that in a 12-month period through 2021, 22,549 staff left the profession, of which 18.3% stated it was due to stress and pressure, 13% left due to workplace culture, and 11.8% left due to the COVID-19 pandemic. Interestingly, despite the government's pledge to increase nursing staff by 50,000, nurses, ambulance workers, junior doctors and other NHS staff have protested in a series of strikes in 2022 to 2023 due to concerns over patient safety, staff shortages and staff having real-term pay cuts. Essex et al. 2023. The statement of unison from healthcare workers identifies that there is still a significant way to go for both the government and the unions to be aligned. Due to the impact of the deteriorating staff morale and poor mental health, NHS England and NHS Improvements have invested £15 million to better support all staff working under the NHS. Additionally, an amendment was made to the Mental Health Act 1983 due to the pandemic, and the Coronavirus Act 2020 was formed, which introduced new laws to protect public health, increase the capacity within the NHS and aim to provide stronger social care. Locke et al. 2021 argues that aspects of the Coronavirus Act 2020 need to be reviewed, such as a change to Section 98, so that the motion debated every 6 months allows for some temporary provisions to be kept, and others to end by vote of the House of Commons. This would break away from the Coronavirus Act 2020's current all or nothing policy. Encouragingly, the Department of Health and Social Care developed a recovery action plan in 2021 to improve the overall well-being of staff and the general population following the COVID-19 pandemic. Some of the key features is that they have put an additional £500 million for mental health services. £5 million of this will go towards supporting suicide prevention and investing in training and education of NHS mental health workforce, to name but a few. However, given the interdependencies of mental health services, additional focus on public health and social care initiatives is required. Furthermore, a more structured plan needs to be outlined to staff on how they can access support and help within their work is needed. A parliamentary inquiry has concluded that staff burnout is at an emergency level and the future functioning of both the NHS and its care systems at a dangerously high level. Lakabuki 2021. It has been recognised that the focus needs to be on a systemic solution at an organisational level rather than an individual basis. Whilst the inquiry acknowledged that there were staff shortages prior to the pandemic, it criticised the effects that the COVID-19 pandemic had on all aspects of the healthcare system. With compassion fatigue among healthcare workers being on the rise pre-pandemic and being multifaceted, it is imperative that change must be made. Upton 2018. Stowell 2022 has argued that organisational resilience is needed to create and share a collaborative vision to establish solutions to reduce compassion fatigue. Waters 2022 revealed that 60 trusts in England spent more than £800 million on temporary staff between 2021 and 2022, and they spent more than £1.7 billion on bank staff. There are 219 trusts in England, however, the number of trusts does not relate to the actual number of hospitals, as many trusts will run more than one hospital. Therefore, the actual number is likely to be significantly higher. The King's Fund 2022. Whilst there is no accurate spending on the total amount of local bank and agency workers, it is likely to be a staggering amount per year. With nurses having real-term pay cuts by at least 20% in the last 10 years, associated with increasing stress and work burnout, it is evident that nurses are leaving the NHS and working privately with agencies to have a better work-life balance, more pay, better flexibility, and the opportunity to explore other areas. Buchan et al. 2019 and Ford et al. 2022. There is limited information regarding the number of agency nurses working full or part-time in England, and this is something which needs to have further research and development into so that we can understand the full impact that agencies are having on the NHS. The NHS long-term plan was introduced in attempts to continue moving with advancement in medicine, society changes and health needs over a 10-year period. With more needing to be done to retain staff within the NHS, a national retention programme was established in 2020, which focuses on evidence-based interventions that will keep staff working in the NHS as part of the NHS long-term plan. As part of the retention scheme at an organisational level, there are several ways to improve retention, such as building strong induction programmes, staff meetings, completing regular appraisals, and supporting staff through training and their development. The NHS Employers 2022. Throughout the COVID-19 pandemic, it was difficult to provide staff with that face-to-face interaction due to their restrictions, and this may in turn have led to their anxiety. However, employees do have a duty of care to manage and assess the level of risk of their staff. The Thriving to Work Report 2017, which sets out a framework of actions that is designed to aid employers to improve mental health within the workplace, could be utilised and made more readily available. As a mental health first aider and a trained ACP, providing care to other colleagues and patients through other means such as remote consultations, telephone calls, emails were done to ensure that support was given. Murphy et al. 2021 highlighted in a longitudinal observational qualitative analysis study that although there was some uptake in remote consultations prior to the pandemic, this was rare and the rates were low. Whilst remote consultations were deemed a success in this study during the COVID-19 pandemic, the model will need to evolve as there is limitations to it. Rosen et al. 2022 has warned of risks associated with remote consultations, such as safeguarding concerns, misdiagnosing, providing inadequate safety netting, and more needs to be done to mitigate the risk. Therefore, clinicians need to overcome technical obstacles and discover a means of providing safe care and safeguarding patients and their data, and therefore organisational support appears to be crucial. This can be done through good leadership and communication, which can have a positive effect on people. LeBlanc and Nowisk 2019. Controversially, Greenberg et al. 2020 has warned that more needs to be done on avoiding moral injury, and leaders within an organisation must be transparent, open and provide regular contact to monitor the well-being of their staff. Elliott 2016 explained that nurses provide a vital role in influencing the organisational strategic plan. Self-leadership and individual level construct will lead to higher levels of team trust, power and commitment. This will therefore make it easier for new and even more risky forms of shared leadership to emerge in a team environment. Blight et al. 2006. Stigma persists and poses a significant threat to the healthy functioning at the macro and micro sociological levels, despite increased advocacy and promotion of mental health. Holder et al. 2018. Mind 2022 has reported that only 1 in 5 people have support enough to open up to their manager regarding their mental health. Since WHO and the World Psychiatric Association implemented awareness and anti-stigma programs, Stewart 2016 has discussed how groups facing stigma have benefited, but more research is needed to examine the nature of stigma across cultural settings, but it is a promising start. It has been said that nurses have been societalized to care for others and therefore put themselves second. Ham 2017 argues that with an ever-changing healthcare system which leads to burnout and stress, self-care remains of high significance for nurses to avoid detrimental effects. There has been a boost in campaigns attempting to signpost any new information to staff who would benefit from mental health support. There are self-assessment tools, digital apps, local charities, counselling, online resources, and websites which offer trauma-focused therapy. There are some limitations to get the trauma-focused therapy, as you need to be registered with certain unions, and this may exclude staff, such as allied health professionals, such as paramedics, as it is not a requirement for them to be part of a union, and this would make them at a disadvantage to getting that support. Within my area of work of primary care, my organisation wanted to better support staff regarding the mental health, and so the implementation of mental health first aiders was done. Although not mandatory and mental health first aiders will need to do an additional course, it can be really beneficial to staff so they know exactly who to turn to about a mental health issue. It can help end stigma, and mental health first aiders can be a role model on how to better manage and advocate for mental health. And finally, the course can be linked to their CPD and revalidation. There are 3 levels of training which could be done, however these are not always necessary and it will be dependent on where you work, as level 3 focuses on more of an organisational change. Having a mental health first aider within a workplace can benefit the staff and the organisation, which will improve the macro and meso effect of the mental health in the hope that it will prevent burnout, stress and work-related absences. Terry 2009. As a mental health first aider within primary care, it has been deemed a success. It has seen an uptake of people seeking support as they are more open to having conversations about their mental health. However, Thompson et al. 2021 recognised barriers to mental health first aiders within the workplace, such as employees reluctant to engage within the programme, negative attitudes regarding mental health and perception of mental health first aiders' role. It is therefore imperative that employees are interacting with mental health first aiders on a regular basis to promote the role to ensure its success. From this review of mental health of staff within the NHS, specifically focusing on nurses, while some level of stress and burnout was present prior to the COVID-19 pandemic, this has escalated the rate of people who are suffering from some form of mental health diagnosis. Although there is support being done at government and local level, we need to consider is enough actually being done. If soaring levels of leaving staff, declining mental health, strikes and minimal improvement of pay continue, it is likely that the NHS is going to continue facing challenges which could lead to the collapse of the NHS. On reflection of the information gathered throughout this assignment, I am left pondering about the future of what an ACP looks like and if we will be able to deal with the mounting pressures on us, as it is apparent that despite support being provided and government pledges, we are seeing more staff leaving the NHS than we are recruiting, which would suggest that these innovations are failing. It is therefore recommended that government bodies, employers and employees work collaboratively for a complete overhaul of the NHS so that we can work together in attempts to salvage and save the NHS.